I'm thrilled to invite a doctor who's going to share a lot of very important information for a big portion of my client base. Chrisandra Shufelt, I just met, and I fortunately met them through her great colleague, who we've spent wonderful time with, Stephanie. Thank you. So, first of all, tell us what you do and how you guys know each other, just to get the connection started.
Right. So Dr. Faubion and I work together at Mayo Clinic in the women's health space, and I'm the division chair for general internal medicine, which actually is where women's health sits. Women's health beyond just reproductive medicine. And we've been colleagues and friends throughout our whole career, and I've recently joined the Mayo Clinic practice, having been on the West Coast for many years. But my real interest in women's health is the intersect between hormones and heart disease. And originally when I started out doing research, I was focusing a lot on the menopause and the perimenopause time, which we have really studied and have gotten a better understanding of that. And then I looked back a little bit earlier in a woman's life, because reproductive lifespan is important. It's important for, reproduction, but it's also important, as we now have learned, for overall heart health going forward. So I'm looking at research in women in their 20s, not just women in their 40s, 50s, and beyond.
And so tell us what you're finding. I think this is really a hot item of conversation for this age group who have gone through, as we discussed, a COVID experience that I think was extremely difficult.
Right.
And I think the stress and the pressure have had a significant effect on them. So what can you tell us?
Right. So stress is profound throughout any woman's lifetime, but importantly in a woman who has already started her menstrual cycle, so in her 20s, there's a condition that can actually cause, stress can actually cause the reproductive axis to shut off. And what I mean by that is women would be going around having their menstrual cycle every month, having their period every month, and then all of a sudden it shuts off. And stress is one of the reasons it can shut off. We can also see it from over-exercise or restrictive eating patterns or weight loss. And sometimes those all go together. And what we see in this condition is women don't think something's wrong. They might not seek treatment because they're not having hot flashes and night sweats like we see in menopause. It's actually a different condition. But these women are walking around without estrogen in their body. And so these are women in their 20s who should have estrogen throughout the monthly cycle, and they're walking around with levels similar to what we see in menopause. But more importantly, in this condition, it shuts off the brain-ovary connection, but it overactivates the brain stress connection. And so what that does is that increases cortisol in the bloodstream. And we think the combination, and our research has shown that not only are they at risk for thinning bones, because estrogen is important for bones, we have shown an early signal for heart disease. Now, it's a blood vessel dysfunction, and the good news is it's reversible if we catch it at this stage.
Wow. Wow. That is really big news. That is really a big conversation, which I think we should break out as simply as possible so everybody has questions answered. First of all, I'm so glad you brought her because she's continuing the conversation where we were. So let's just talk about the blood vessels for a minute, because so what happens to the blood vessels? Are they constricting, or what is different about them?
So heart disease takes at least a decade. And when I say heart disease, in a woman, or a man for that matter, it's where we start to see plaque build up in the heart arteries, and eventually we start to see things like heart attacks that can occur.
Right.
And so this, one of the first signals of heart disease developing is the thin lining that lines all the blood vessels is called the endothelium, okay? It's a one cell layer lining, but it is vital for controlling how blood vessels dilate and constrict in response to things like exercise, in response to things like stress. It's also important how we get blood flow to the heart, and it's like the control tower for our blood vessels. And there's a way that we can test for dysfunction in this lining, and that's what we've identified in about 1 in every 3 women with this condition. Now, what we're studying now is trying to determine, is it the stress component that's giving us this dysfunction, or is it the, believe it or not, is it over-exercising? Is it exercising without estrogen? Is that, taking 2 steps forward but maybe 1 step back?
Yeah.
Or is it the restrictive eating? Is it not having enough good calories or good nutritional content, or is it kind of a combination of all? So these, I call women with this condition, by the way, the condition's called functional hypothalamic amenorrhea, big name, but hasn't really been identified and studied much. I mean, the Endocrine Society came out with guidelines for this in 2016, and even original research has not been talked about. And I think that also comes back to the fact that nobody's asking about the menstrual cycle.
Yeah, so just to be clear, would this only be identified if the menstrual cycle was interrupted? So that's when I better check out what's going on.
Right, you better seek.
So that's the signal.
Yeah.
Okay.
And I always say the menstrual cycle is a vital sign. We check your blood pressure, heart rate, check in and make sure your menstrual cycles, because a menstrual cycle that's happening every month is healthy. A menstrual cycle that's irregular or has abruptly stopped, there's many conditions that can happen that can cause that, but it's important to understand in you what's causing that. And stress, for this condition, stress is a big component of that.
So, and I just want to talk a little bit about the bones. So without estrogen, then the bones are. Now, what is happening to bones in a 20, 30-year-old woman is like, if there's no estrogen, what's happening?
Well, oftentimes we sometimes see this in athletes where they'll develop a fracture or a stress fracture or a long-distance runner, which is a signal for us that the bones are thin. And the disadvantage here is that we, as women, hit our peak bone mass, so we're going to make as much bone as we can, and that's about the early 20s, mid to 20s.
Whoa.
And then after that, estrogen's important, maintaining bone. Muscle mass is important. As strong as your muscles, as strong as your bones. But then we start to see this decline. So if women have this condition, are walking around without estrogen, they're not even going to give their body the ability to hit peak bone mass.
Wow.
So they're kind of starting out behind the curve. So, and we know thinning of the bones, especially as we age, is our biggest risk factor for hip fracture, which is our biggest cause for disability in women, and nursing home admissions, right?
No, it's critical. It's, I think something every woman has to deal with. I just think it's so universal. I certainly have been dealing with it too. So I'm in fashion. People who are paying attention to fashion are confused about what's the body, what's the perfect body. There's a lot of promotion of respecting all body types, which I think is not as authentic and sincere, but maybe sometimes just done as an opportunity to appear that way. I think a body that's overweight is just as unhealthy as a body that's malnutritioned and not taken care of. So the confusion of how to look beautiful, especially in this age group, is misinterpreted sometimes, and
Yeah.
crazy diets. I mean, I know my age group, I can't even remember what we ate or what we thought was going to be thin for us, but smoking was big then. So, you know, if you smoked, you can smoke a cigarette instead of eating a hamburger. But now there are other methods and other things. But I think compounding that with stress at this time and affecting the hormones is really the big factor that you hit right on the head. So COVID and stress,
Right.
and stress and social media, stress and identification, stress and self-esteem or lack of self-esteem. The 20s and 30s are rough
They're
years.
tough, yeah.
And people say to me, wouldn't you love to be 28 again, 30 again? No, shoot me. That was rough.
It was
Don't
tough.
want that. I don't know. I'm good. I'm okay. Don't want that. I wouldn't want to go through that again.
Right.
So this girl really needs a support system that is information that she could rely on. And I absolutely am, I'm so excited that we can have you talk to her about this. So what can you say as far as dealing with stress? I mean, you have daughters, so I'm sure you've had these conversations. Like, what is the advice? How does she get help with this?
Right. And you mentioned COVID, and I'll just speak to the fact that the American Psychology Association did a survey about COVID and found that Gen Z, 80% of Gen Z changed their lifestyle behavior because of stress during COVID. So that speaks to the fact that this is an important not for just mental health, but also important for overall health. Mm-hmm. And I think there's so much information and misinformation out there that is constantly getting bombarded to women. And so there's that level of stress. There's also the level of stress for being successful. We want to empower women and have the ability to give them that empowerment, but with that comes some stress too. So, you know, in this condition, what has been shown to reverse it really is not a birth control pill. A birth control pill is actually just covering up like a Band-Aid, right? Yeah. It's just giving fake hormones, and we've actually shown that doesn't help their blood vessels. What has been shown to help is something called cognitive behavioral therapy, which is a way that you can rethink how you're dealing with stress. So that's one component of it in terms of how we can reverse the condition. Mm-hmm. How do I approach stress, whether it's with my daughter, whether it's with my patients that I'm counseling, or even whether it's with some of the women that are involved with our research study right now that have this condition? Mm-hmm. I think it's really getting to what is the root of the stress, and that sometimes that having that insight is, and knowing that this is now impacting my overall health. Because in your 20s, I felt invincible in my 20s. Yeah. I didn't think about the long-term health effect of bone loss and heart health in my 20s. I just figured, hey, if I'm not having my period, okay, I'm not pregnant, and therefore I'm good. I'm good. Yeah. So I coined this the walking unwell, but it's really getting at the root of the stress too.
But I will tell you, I believe for the first time, people in their 20s, Gen Z in their 20s, know something is wrong. They know something is not right. They are fearful, and I think they are incredibly stressed. This is even post-COVID, it proves to all of us that there's an unevenness in our lives that we can't control, and they are inexperienced in understanding how to deal with life's problems. I know young people that come into the company or interning or in that position, something goes wrong, that's it, it's the end of the world. Like, oh my God, it's all over. No, this is actually the way it is, and so you solve a problem and you prevent problems. You Problems are part of your life, but this is the first time you're realizing that this is going to be a part of how you are as an adult.
Right.
And being an adult is a very big deal right now as far as managing it. So you talked about this cognitive
Behavioral
therapy. So what is that?
So it's a way for you. It's actually a 3-part. You actually give you work with a psychologist, and it's actually also been shown to be effective for hot flashes. But it's recognizing your emotional feelings and how you feel when these certain things are going on. Like, is everybody looking at me? Oh my gosh, is everybody looking at me? It's almost it's a way to reformat your thoughts, but also understand what's going on in your body. The brain-ovary connection is not working correctly. I need to understand how to reverse that. So it's actually a different component of training what's going on in your body, understanding the condition itself, and then dealing and giving tools to cope with it.
And social media is just, I must say, some Gen Zs that I've been meeting have detached from social media, have decided not to engage, but most are. And social media is
It's a way of communicating.
tough, hard platform for people to get lost in, and it's very easy to get lost in it. I'm very disciplined, but if I sit down like I'm exhausted and let me see what's going on Instagram, and like an hour can go by. It's like I actually the other day, I was tired and I didn't want to get up because we did the collection and everything. I got wasted an hour of my life on what's
something that's not even real,
stupid,
right?
Yeah. So that is Gen Z are engaging and seeing what other Gen Zs are doing, and other Gen Zs may be looking better, acting better, found this, are doing that, and then you start the comparisons. And social media has a mean spirit to it as well. Right. And I think the stress is extraordinary. Stress that I can't imagine.
It's stress, it's
teens
unrealistic expectation, it's an element of perfectionism and attaining something that might not be there. I mean, growing up in the 80s and 90s, our social media was the covers of magazines, right? That was it.
Right.
And you only got to see that perhaps if you got your magazine in the monthly magazine or at the grocery store.
Right.
But it wasn't constantly every 15 minutes getting on. There's almost addiction patterns to different ways that we seek social media, and we seek it for different reasons.
I don't know if there's an app for this therapy, but I think somebody needs to get this philanthropist person on the case to get an app, which is easy for Gen Z to interact with. But I think an app would be great for all of us. I had an incredible conversation yesterday with Dr. Sood from the Mayo Clinic. Do you know him? Yes. And I'm going to have him on as well. And he did 2-minute gratitude with me, and it was unbelievable. It was, at first I thought, what am I doing? What is he doing? I don't know what this guy is doing. I don't know what he's about. I have no, and then the simplicity of what he did, and I thought, this is the most profound thing I've experienced in years. I mean, it was so simple, but for 2 minutes, I realized how I can have a really healthy relationship for the rest of my life. I found he gave me a tool, and maybe we need to talk to him to do something or have some. I think if what you just said can have an app or a tool so that Gen Zers have something to use when they're feeling stressed, or make it a practice that they do once or twice a day, I think they would do it, because the stress is so devastating and they're so overwhelmed.
Yeah.
They could.
talked about that.
Well, it's quieting your mind, because we have all this negative self-chatter going
Right.
on in our
Right.
heads, and it's really just getting you off that and on something else. So if you just break that negative self stuff going on, then you can get yourself into a better frame.
Which is what meditation is, and obviously in my generation in the 70s, TM was everything. So in 1970, I started meditation, and I still use the same mantra, and I use it. However, I think in the hyper state and the effect of social media being so present throughout the day, that you need to have a tool. Like, it's not that easy to break away and still be part of the culture you're in and then detach. I mean, even for us as adults to do that, sometimes you need to kind of really, sometimes I'll go in the bathroom and close the door, so I'm really detached to meditate. But if you're Gen Z, you're at a different time in your life. You have a lot of pressure, and
It's go, go, go.
yeah.
It's finding the time, too. I mean, whether you're living in a busy city or in a smaller community, it's also, we aren't taught to slow down. We're taught, like you just said, is to go, go, go. And I think we need to teach those skills to, literally to stop and smell the roses, right?
Yeah.
And to slow down and to really take one step for yourself.
Yeah, I mean, we can all use it,
Right.
but I was just with a whole bunch of FIT students, and they're, I love them. They're who I was when I was their age, so I identify and I want to, what can I do? But I could see that there's a stress level, an expectation that social media presents that really is difficult. But if this stress is affecting estrogen
And stopping the menstrual cycle.
That's a signal that we need to sort of talk about, and talk about a lot. I mean, there should really be a campaign for it, because I believe the population of young women who are experiencing this is not minimal. I believe it's...
We opened this study at Mayo Clinic where we're actually studying 100 women with this condition for just 3 months. They're wearing a Fitbit. We're looking at sleep cycles. We're looking at stress scores. We're looking at their blood vessel function. It's only 2 visits to our campus. But when I opened up the study, it was meant for a study across the U.S. because we fly women in. I couldn't tell you. We were getting calls from Japan, Egypt, South Central America, so much so that now we're opening an international registry, because this is a condition that, first of all, it's under-recognized, it's understudied. And if we're not asking about the menstrual cycle, most women get asked as they're taking their blood pressure at their OBGYN visit once a year, once every 3 years, when was your last period? That's the wrong question. It should be, do you have your period every month?
Yeah.
And are they regular? So, it's also about, we're at an advantage here. I'll say women's health, women are at an advantage in this situation because we have menstrual cycles.
Yeah.
This happens in men as well.
I was just thinking that. How do they know what's happening?
It happens in professional athletes. It happens in stressful situations. They don't have the advantage of having that menstrual cycle to know that something might be wrong. It's usually not until they fracture a bone or they end up with another type of event happening.
Yeah, I would imagine this is something that if you're experiencing it, you're not talking about it. Maybe sort of as an aside.
Well, you don't think it's a problem.
Yeah.
So why would you talk about it?
Yeah.
You look well. You look physically fit. You look healthy. everything's healthy looking on the outside appearance-wise. It's not healthy on the inside.
And so let's talk a little bit more about heart disease and your concerns about where all of that is going in the blood vessels. So how does this manifest itself in a young adult?
In a young adult, this is, like I mentioned, it seems to be about 1 in every 3 women with this condition has this. We're really trying to identify which ones. Endothelial dysfunction is that thin lining dysfunctioning. It is what I call the first domino in the cascade that would kind of create a concern for heart disease later on in life. But it's also the first domino that if you tip it back upright, the domino effect won't go on. We can prevent it, and we can reverse, if we can reverse endothelial dysfunction, it's not going to go into that.
And preventing it.
So that's a beautiful question, because what the research that we're in, our next step for research is, okay, let's reverse the condition and make sure that the blood vessels go back to being healthy.
We don't even know how to do that right now.
Except for cognitive behavioral therapy, which has been studied in small studies.
See, I think that's where some work needs to be done, and some getting the word out about this. This is actually the first real conversation that I have had with anybody about this and about this age group in young women, and the universe brought her here because it's a continuation of it really completes the conversation that it starts. We talked about this, starts early. I want to help in getting the word out about this, and I think the more we can talk about the therapy and how that works, and maybe even do something live here with some young women to talk about it. I really feel this is a critical time. I think the stress factor for young adults, and I'm far from being a mother or grandmother, I actually can be your mother, but the young people I see, I am so aware. I've never seen this before. I also witness a lack of the ability to retain information. I think there's a difficulty in
It's stress.
It's like all of the things that menopause brings on with that phase, all of those things. I see the pressure and the stress of being frustrated, anxious, not comprehending simple concepts, and we're talking about intelligent, educated. This is not for any other reason, but it is clear that stress or one incident happens, and wherever the stress is already with them, it tips and it becomes so much bigger. What is that?
So we are starting an international registry where women can sign up if they have a confirmed diagnosis. If they don't know why they've stopped their period, we will be having a list of labs that they can get from their doctor.
Right.
And we will be handing out questionnaires. One of the problems is we don't know how prevalent this is. It's estimated about 2% of young women stop having their menstrual cycle. We suspect it's way more.
Yeah.
I mean, just from the number of phone calls.
2% my generation.
Well, these are where the studies are
2%
from. They're from the
generation.
1970s, and that's what we're quoting.
Yeah. No.
So we don't even really know how.
It's not recorded in a medical record because nobody puts
menstrual cycles
in the medical record.
Absolutely not.
Just put people on a birth control pill, so no one ever knows that it's been a problem.
Yeah, that's the solution.
That's the solution, and now we've shown that it's not the solution.
And we don't know, think about it, so we don't know if these are the same same women that are having high blood pressure during pregnancy, that are getting gestational diabetes during pregnancy. Both of those set you up for an increased risk of heart disease later. So this may be reflective of a much bigger problem. This may be the tip of the iceberg, but we need to get at how big is this problem before we can even tackle it.
Yeah.
And so I think identification of these women. So we do have a registry, and we are at Mayo Clinic. And people, how do you want people to contact you?
Right. So we have the ongoing study right now that's funded by the NIH. Great, because that's our tax dollars at work. We have a QR code. I can provide a QR code
So
as a link to the study.
We'll put it up with the podcast.
Yeah.
I think the 2% is my generation, clearly.
We both agree.
It might have even been higher than. I really believe that if we have an open conversation about this, it would be extremely helpful for a lot of young women who can make a decision about taking action.
And I'd like to see how prevalent it is in certain industries, in the fashion industry. We know it's very professional athletes, dancers, professional entrepreneur women. Mm-hmm. I mean, the average age in the first study we did was 26. That's a pretty significant age.
Yeah, I mean,
think about all the people that have food scarcity, that are facing unemployment. So those critical stressors that the basics are at risk.
Yeah. I don't even know what the role of social determinants of health play in this condition. Because if you're worried about where your next meal is coming from, you might not purposefully, but you might be having restrictive eating patterns out of the need. And so does that then shut off the access?
Absolutely.
We don't know what all these medications for weight loss are doing, because a lot of individuals go on these weight loss, lose a significant amount of weight.
Yeah.
And weight loss is one of the causes of this, but stress again is a poignant cause.
It's just I just think it's indicative of an age group that is experiencing something quite different than any other generation has experienced. Right. And I think it's at a critical point, mostly because of social media, but add an extreme COVID experience, and not just 2 months of it, but years of it, and then the aftermath of years of it. I think it's a conversation that has to be had. So we have to think about a little bit more information, and we'll try to help get that out. And also, I have some ideas, but I think that this therapy needs to be shared. I think if there's a demo or maybe a short video that we could put up, some instant tool, right? Just to be aware of what that means, what it looks like, anything to put the power in their hands, because if they have to go see someone and then they may not have the money, or they may not,
or they might get put on a birth control pill,
or some other, or it just makes them more stressed, to be honest. I think there'll be some that want to be a part of a study, but I think a lot of them would just rather not talk about it, or kind of like just keep moving on because they're fine and they're invincible. But I think if there is a little video or some tool that they can start with, and then we can try to provide more information as your studies progress. But I think this was extremely helpful, and a good part of my distribution is this audience, so I feel really grateful for, I guess, my gratitude, 2-minute gratitude session with Dr. Sood was worthwhile.
Well, we are grateful for you, because this is a condition that I think the other great side of the coin of social media is that's how we are promoting this research, and that's how we're promoting knowledge about this. Because if you're not talking about it with your doctors, you might talk about it with your girlfriends.
Yeah.
But it's awareness that this condition exists. It's getting more common, most definitely, because of the stress, but also what's out there to help.
So I think if you could just, so we can have a clip for this, if you're of a certain age, what should you, I think if just give me a little 1 minute on this so we can.
So if you are a woman between 18 and 40 and you've missed 3 or more periods in a row due to what we would consider due to, if you don't know what the reason is you missed your periods, we would need to check hormones, make sure you're not pregnant. But this condition is due to stress, over-exercise, under-eating, restrictive eating patterns, or weight loss. And it's when the brain is turning off the signal to the ovary and it's stopping, it's lowering estrogen. So very low estrogen levels. And then the hormone from the brain is very low, unlike what we see in menopause. So that's the reason that the diagnosis.
So if you have a pause in your menstruation and you're in this age group, pay attention, act on it, and deal with it before you do damage to your body.
Correct.
Okay.
And ultimately, if you're not getting your period monthly, or if you stop your period abruptly, that's a health signal.
Yeah.
You know, having a menstrual cycle every month is important.
Yeah. Well, thank you both so much. I really appreciate it. I think this is going to be a big audience between the two of you. We have mothers and daughters and everybody to pay attention, but I'm thrilled to share this information, and I think we should continue talking about it and stay in touch so we can follow up.
I know.
I'm just thrilled to have you. I know you guys are like the best, and highly recommended by the best doctors. I mean, I'm so honored to have you here, and I really want to keep talking about it.
Absolutely.
So thank you
We'd love
both.
to.
It was such a pleasure. Thanks.
Great.
All right.